Okay, here we go with the second part of chapter 4. I want to go over a couple of things with you. When it says disease and disorder terms built from word parts, it means that we already have the skill to be able to split these words into their word roots, their prefixes and suffixes, and without even really knowing what it means, we can then piece the word parts together to get a definition. We're not going to go through all of these individually, but I want you to understand what that means. When we say not built from word parts, these are things that you are going to have to memorize. I have given you certain ones in the exercises that I do expect you to know for the test. I've given you the ones that are most commonly used. That's not to say you'll never see these, because all of these, quite honest, are very common. Here again are some more. Let's go through a couple of pictures. These pictures can be found in your textbook as well. Okay, here we have dermatitis, contact dermatitis, seborrheic dermatitis. Dermatitis just means inflammation of the skin. So as you can see, there's just like some redness and some, looks like a rash kind of thing. Impetigo is just a skin condition as well. I wanted to call your attention to this right here. Shingles, which is the herpes zoster virus. This you get once you have, like if you've had chicken pox when you were younger, and you get exposed to the virus again. Especially, you can see the commercials about the elderly people getting shingles. This is what happens. It forms these very, very painful blisters on the skin. This is right here. You ever heard of ringworm? Yes, everybody's had ringworm when they were a kid, probably. When you get exposed, so you get it from cats. This is what ringworm looks like. This is athlete's foot. This is a picture between a person's toes. If you can't tell what that is. These all represent different types of cancers of the skin. This is a melanoma. This is going to be one of the more common ones that you're going to see. You can tell it's just, it can't be mistaken for a mole. It just looks very different. Okay, on to the next part, the surgical terms built from word parts. Again, you could split these up using our slash marks and define each word. Not built from word parts, I've given you a list in the exercises. This is streptococci. This is a bacteria. Have you ever had a strep throat? This is what the actual bacteria looks like if you were to stain it and look at it under a microscope. This is staphylococcus. I'm sure you've heard of somebody having a staph infection. A lot of times it's just, it's a skin condition mostly, but it can also get into the bloodstream and get very dangerous very quickly. So you do have to take antibiotics right away. If you've ever had a boil, or also what's known as a furuncle, that's what it is. It's a infection of staphylococcus. Again, some more complementary terms, and not built from word parts. What does that mean? Memorize them. This is a burn keloid. This is the scar tissue that forms a lot of times after a person has had a severe burn to the skin and they've tried to do skin grafts. A keloid isn't just the result of a burn. It can be a scar from any incision or any trauma to the skin. It's when it gets real raised and hard like. This is something called a pressure ulcer or a decubitus ulcer or a bed sore. If a patient's laying on a certain position for a long period of time, this is what can happen. They can get this real inflamed, real infected area of the skin. And it's important, that's why it's important that a patient be rotated when they're in the bed and they don't leave them on the same spot for too long. Last part of this is the abbreviations. Again, I gave you a list of the ones that are most common, so be sure you do the exercises and make your flashcards.